This is the most important video on YouTube for NEET PG aspirants, those who are starting now. Maybe your internship is over, or maybe you are preparing now for the best shot. So, first thing, what you should do is you should stop asking the question that is it possible. You should focus on your daily targets. You should focus on the process, enjoy the process. Don't think about the results. If you start thinking about the results, then you won't be able to give the maximum effort. The second important thing that you have to do is that if you have completed your internship, it is better if you don't go for non-academic GRship if you are serious for the NEET PG 2026. And if you are working also, it is better to quit working if financial constraints are not there, because you will have to focus these 3 months seriously, then only you can get a good rank in the NEET PG 2026. So subscribe to my channel. We are very soon to hit 50k subscribers. First thing is that you should eat the frog. That literally means that you first need to complete all the major subjects of NEET PG. NEET PG marks weightage is more or less constant. I have classified according to heavy weightage, moderate weightage, and low weightage subject. You should complete all the subjects. You shouldn't leave any subject. But at first, complete biochemistry. It has 13 questions. Microbiology 12 questions approx, pathology 13, pharmacology 14, commed 16. Medicine, you should study medicine. You shouldn't neglect medicine, because 1/10 of the questions come from medicine. That is approximately 19 to 20 questions. Surgery, very high yield, 21, and OBGY 19 questions. In moderate weightage, we have anatomy with 7 questions, physiology 6, FMT is high yield 9 questions, eye 8 questions, ENT 7, pediatrics 10, dermatology 6, orthopedics 7. In low weightage, nowadays anesthesia hardly 2 or 3 questions come, but average last 5 years is 4, psychiatry is 4, radiology 4 to 5 questions come. So complete according to the weightage of the subject. Complete at first the heavy weightage subject, then the moderate weightage, then the low weightage subject. Your ideal schedule should be, when you are watching this video, complete the first revision by 10th of August, watching the videos and revising if you haven't watched the videos, and you do only the previous year topics in the last 17 days. So 18 to 30, you need to do only the bookmark previous year questions and the topics in the last 2 days, the volatile topics you need to revise. What will be the plan? According to me, it is best to watch the rapid revision videos. Now it is not the time to watch the main videos content, because it is extensive. Rapid revision videos, approximately 200 hours of lecture. If you give 4 to 5 hours each day, then it will be completed in a matter of 50 days. Max to max, it will be completed by 50 days. If you ask me what is the best source without any sponsors, if I tell, if I were in your place, I would have utilized these sources. First, maximum subjects from Marrow RR, because the faculties are great. Some faculties are better in prep ladder, like patho, micro, Preeti ma'am. Medicine, Marwa sir gives the gist of medicine in a very short course. Pediatrics is extensive in Meenakshi ma'am's RR notes. So you can do that from prep ladder. And pharmacology, best source is GRG sir's notes. I did GRG sir's note, and every question in NEET PG came in common from that notes. Psychiatry is also better in cerebellum. So these two subjects you can do from cerebellum. First thing you will have to do is watch the videos, read simultaneously the night, 4 to 5 hours you will be watching the videos, then read the thing on the same day, then your second revision will be completed within your first revision. After finishing the subject, solve the previous year question. Now the question is, how many of previous year questions and which all previous year questions to do. Since you have limited time, for you, I will say 5 years of NEET PG is sufficient, 3 years of INICET and 3 years of FMGE. Either from Marrow or from PrepLadder, these two are authentic previous year question apps. Don't do from any other app, because the explanation won't be sufficient. And why the explanation is necessary? Let me explain you. You will have to add the extra points and highlight the previous year topics in your notes like this. Like this anaphylactoid reaction was not present in my notes, but it came in aims. So I added the whole topic. What is anaphylactoid reaction? It is the IgE mediated degranulation directly of the mast cells. So it is caused by NSAIDs, contrast media, and sometimes opioid also. These all things I have added extra, like IL-13 causes release of mucin. This also I had added extra. IL-4 stimulates B cell and it leads to stimulation of mast cell. IL-9 stimulates mast cell. These were the extra points I have annotated in my revision notes. So you will have maybe printed notes because it is not possible to take handwritten notes at this point of time. So in your printed notes, all the things that are extra from the previous year question explanation, you will have to add the important things in your revision notes. Then only it will become sufficient and the strike rate will increase. In case you are having short of time and you can't do the whole process, then you can go through my NEET PG previous year topic list or the three previous year topic lists separately. It is more extensive: NEET PG, INICET and FMG. Just add the extra topics, the previous year topics which you are getting, and highlight all the previous year topics. Why to highlight? Because I said in the last two revisions, that is the last 17 days you need to only focus on the previous year topics. Last 2 days you will solve the bookmark previous year questions which you have bookmarked during solving the previous year questions, and the volatile PYTs. Last 3 days you are going to do this. That's why it is important that you highlight and mark each and every previous year topic. The next part, before that, I will tell you to join my Telegram channel and WhatsApp channel. It is free because INICT toppers like INICT 26 rank, AIR 33, they have joined my Telegram channel. AIR 184 also did my INICT PYT list and also went through my digital image bank and it was helpful. AIR 471 also said that the image bank was helpful and the marks distribution, and AIR 1622 also was a member of my channel. So do join it. It is free for all. Daily MCQs are given. Some flashcards are also given. Some audio solutions are also given. So do join that group. Coming to the next important part is GT. How many GTs to give? At least you should give 9 GTs, 6 from Marrow because it is the most authentic app among GTs and the percentile and the marks is more or less predictive. But it is a bit difficult, not like the real exam standard of NEET PG. So you give 2 free GTs of Prep Ladder or doc tutorials which simulate more like the NEET PG, a bit easier compared to the Marrow, and give one damn CBT to get the real life exam hall experience. Example, I give you one of the aspirants booked my personal session and he was very disheartened that he was getting only 100 corrects in Marrow. So I told him to at least switch and give one GT from doc tutorials or prep ladder. He gave one from doc tutorials and he messaged that he got 143 corrects. That means your GT score does not reflect your whole performance. Those who are doing GTs from Marrow, who have studied all the materials from Marrow, they are going to get more number of corrects in the Marrow, and it is more difficult also. So you need to change the GT source to boost your confidence, to know what other exam platforms are also setting up question paper. So give 2 free GTs from Marrow or PrepLadder to prevent the Marrow bias. Coming to analysis, how to do the analysis of GT? Like this, you will have to make a paragraph. If you want, you can take a screenshot or join my Telegram channel. I will provide this PDF in the Telegram channel. First thing is the GT serial number. You are giving 9 GTs. First 3 GTs, you will accustom yourself to give 3 hours and 3.5 hours at a stretch. Next 3 GTs, you will be familiarized with the environment and you will have to finish on time. Last 3 GTs, you can analyze your performance. Percentile, you will have to mention. Percentile is more predictive than the marks, but don't take this in heart because my best GT rank was 72. The interview I did with Harsh, his best GT rank was 300, and we both got top 20 rank in NEET PG and INICET respectively. So your GT performance does not define you. And nowadays, more and more people are searching from AI, so the authenticity of GTs is also reducing. So focus on the GTs to improve yourself, not on others. You will have to mention the marks, the number of corrects you are getting. In the wrongs, it is important that whether it is a recall error from the notes, then you revisit the notes and you see what you have forgot. If it is a silly mistake, you need to focus throughout the exam. If it is a new information and more than 40% is getting correct, this is the crux. If more than 40% are getting correct, then only add it in your notes or a GT mistake copy if you are making. And if you are making a GT mistake copy, then review it before giving the next GT, then your GT corrects are going to improve in that app. Coming to guest corrects, if it is a two option confusion or three option confusion, you must go for marking the question, and you should assess that how many you are getting correct from the two option confusion and three option confusion. Then only it will define you in the exam day that whether to attempt the three option confusing questions or not. If there is four option confusion, then I will advise you it is better not to attempt if you are not having a powerful intuition. Always see the bottom four subjects, so mention your bottom four subjects. In the marrow you can get the bottom four subjects, so mention the bottom four subjects in the next GT. Before giving the next GT, focus on reading those four subjects. Ultimately, those four subjects will come to your stronger hold. Next set of four bottom subjects will be there. Focus on them. Ultimately, all the subjects will be in your stronger hold. Second revision, as I said, read only the previous year topics. With that, what you have to do extra is in the morning 9 a.m., which is supposedly the exam time. At that time, you solve 40 questions in 30 minutes. Keep 12 minutes extra for reviewing. Okay, in the main exam day, also, you will have to finish 8 questions. You will have to finish 10 questions in 8 minutes. Try to finish all the questions in 30 minutes, leave the long stem question, then revisit them in the rest 12 minutes, and review all from first to last to avoid silly mistake in the last 12 minutes. And in the evening also, you can do when your brain is slowing down, you can give a dopamine boost with solving MCQs. So 40 questions or maybe 80 questions in 60 minutes. Try to do custom modules. No need to do QBank modules, because I have taken interviews of many toppers. I have also personally not used QBank. So everyone says that QBank is not that much high yield, and at this point of time you are lacking time. So focus on the high yield material. Do custom modules with hashtag of recent NEET, hashtag INICT, hashtag drug of choice, and hashtag image based. One question will arise: how to access the FMG questions from Marrow. For that, you need no other plan. Just go into the three bar and click the plan and select the FMG plan. Then only you will get access to the FMG questions for free. No need to buy any other app. It is available on your Marrow subscription for free. Thank me later. Coming to NEET PG exam, among the 200 questions, 100 to 130 questions will be previous year topics of NEET PG, 1 to 2 questions directly repeated from NEET PG. I tell you one stat which I tell in my personal sessions is that in NEET PG 2025, 15 questions were direct repeats from FMG July 2026, and 50 to 60% topics were repeated. So this time, my advice is watch the recall of FMG June session. Many questions and topics can come in common because it is occurring in the same period and the exam taking authority is the same. 10 questions will be by applying your common sense. Some community medicine questions like how to hold water for water analysis. So some common sense based questions will be there. Next is the applied questions where you will have to apply your concepts. 20 to 30 questions will be there in this applied section. 30 to 40 questions will be from your prop based knowledge or your main notes. So if you are remembering some stuff or you are having good hold over your props, or you were a good student during your professional exams, then this is a bonus point for you. And hardly 5 questions will be out of the box questions which no one will be able to solve. 30 to 60% question, because it is very much variable. In NEET PG 2024 it was 60 to 65% questions were image based questions, but in the recent year it reduced to 50 to 60 questions. 90% of the images are not classical, they are the clinical photos of the examiners. So you will have to crack the question from the question stem. In the question stem, you will get the buzzwords which teachers teach during the revision videos. Okay, you will have to just collect the buzzwords from the question stem, and bang, you are going to get the diagnosis. And 10% images are classical, especially the histopathology images or the radiology images, and it is a superficial exam. Knowledge of all the subjects is necessary, not that much in depth as in the INICET exam. Coming to what should be your target score, so it depends on the branch you are going to choose. So the minimum target score for nuclear medicine or radiology, it is 625 and 630 for nuclear medicine, or maybe more, because the competition is day by day increasing. So target 165 corrects for radiology, and for nuclear medicine 170 corrects. For dermatology 162 corrects, medicine 160 corrects, pediatrics 157 corrects, OBGY ortho chest medicine 155 corrects, IENT 150 corrects, psychiatry radiation oncology 148 corrects, anesthesia 147 corrects, pathology 135 corrects, community medicine 128 corrects, and pharmacology and FMT 120 corrects. So subscribe to my channel if you found this video to be helpful and all the stats to be useful for your preparation, and you are able to know what actually you need to target and what you need to study at this point of time. जाते जाते question of the day: blotting technique are important molecular biological tools. This is just a statement. So which blotting technique is matching? Northern blot, the options are there. You can pause the video and answer in the comment section. I will try to give heart reacts those who have answered correctly. Now you can watch the video on most important topics for NEET PG. All the best for your NEET PG.